My name is Gerard Cody. I'm the Public Health Director for the town of Randolph. And in our role in the town of Randolph Public Health, we have a wide variety of things that we work on. We have an environmental health program, a community health program, and an emergency preparedness program. So right now, our main focus is on the COVID vaccination response. But leading up to that, we started out last March, on March 19th, with our first case of COVID-19 in the community. And with that, we had to educate the community about how to identify COVID-19, learn about what the symptoms could be, and also to find out what to do if you are positive, how to prevent the disease from spreading within your own family or in the community. We use terms like isolation, which is something if you have the disease, you would have to stay home and stay out of work or stay out of school. Or if you had to quarantine, you came in contact with somebody who was positive with COVID-19 and you were being monitored to make sure that you did not become sick. So some of the tools that we use to identify folks that may not know that they're sick is called being asymptomatic. We have a testing program in town, and we started that back in August, on August 1st. And through this week, we've tested over 35,000 people for COVID-19 just in Randolph alone. It was open to people that lived in other communities, not just Randolph. And the reason we like to do that is because there's a lot of interaction between the different towns, between Brockton, between Avon, between Holbrook, Braintree. We all interact and we want to make sure people are safe. So we wanted to open up the testing to everybody. And from that, we learned if you are positive, you would need to isolate. And if you become a contact, if you knew that person that was positive, then you'd have to quarantine. But right now, we're in a phase where we're able to vaccinate people. Every week, we would get an allocation of vaccine. And depending on the different age groups that are set by the governor's office as to who we can vaccinate, we'll set up clinics, and you can register on the town website to get vaccinated if you are of a certain age or you have other sicknesses. We call those other sicknesses comorbidities. And we'll learn more about that. Well, within our office, we have staff. We have a community health educator, Peggy Montlouis, is Haitian descent, and she's able to translate for us. And we also have Michelle, who is a town employee who works in the town hall, and she speaks Vietnamese. We also use the language line. It's a translation service that's available to us. And we use a wide variety of media from the Mass Department of Public Health. Well, we use the same things that we learned from the COVID testing. We've had a lot of practice in having people move through a site to get tested, and we're applying what we learned since August 1st when we tested over 35,000 people, what works and what doesn't work. So we found that by setting an appointment, people come out at a time, and it prevents a long wait. If you come within a few minutes of that appointed time to arrive, it'll help things move along quickly.